Adenosine, a medication commonly used in the field of cardiology, is primarily used to treat certain types of irregular heart rhythms, such as atrial fibrillation and paroxysmal supraventricular tachycardia. By slowing the electrical conduction in the heart, adenosine helps restore a normal heart rhythm. However, before using this medication, it's crucial to consult with a healthcare professional to determine the appropriate dosage and administration method. Like any medication, adenosine may cause certain side effects, including temporary chest discomfort, dizziness, flushing, and shortness of breath. By understanding the potential benefits and risks, you can make informed decisions regarding the use of adenosine. To get first-hand insights, this video also explores user feedback and experiences with adenosine. Dive into this guide to gain a deeper understanding of adenosine and its uses in the field of cardiology. Primary uses of adenosine. Adenosine is primarily used in the field of cardiology to treat various irregular heart rhythms. One common condition that adenosine is used for is atrial fibrillation. Atrial fibrillation is a condition characterized by an irregular and rapid heartbeat, which can increase the risk of blood clots and other complications. Adenosine helps regulate the heart's electrical activity, restoring a normal rhythm and reducing the risk of complications associated with atrial fibrillation. Another primary use of adenosine is in the treatment of paroxysmal supraventricular tachycardia, PSVT. PSVT is a rapid heart rate condition that originates above the ventricles, causing an irregular and fast heartbeat. Adenosine works by slowing down the electrical conduction in the heart, which helps restore a normal heart rhythm. This can provide immediate relief for individuals experiencing PSVT episodes. In addition to these primary uses, adenosine may also be used in certain diagnostic procedures. It can be administered during a stress test or a cardiac catheterization to help identify and evaluate any potential abnormalities in heart function. Dosage guidance for adenosine. The dosage of adenosine can vary depending on the specific condition being treated and individual patient factors. It is typically administered intravenously by a healthcare professional. The dosage is usually calculated based on body weight, with a typical starting dose ranging from 6 to 12 milligrams. This initial dose may be increased if necessary, up to a maximum of 18 milligrams. The administration of adenosine is typically done as a rapid intravenous bolus, followed by a saline flush to ensure proper delivery of the medication. This rapid administration helps achieve the desired therapeutic effect and allows for quick evaluation of the heart's response. It's important to note that the administration of adenosine should be done under the supervision of a healthcare professional, as they can monitor the patient's response and adjust the dosage as needed. The healthcare professional will also consider any other medications the patient may be taking to ensure there are no potential drug interactions. Potential side effects of adenosine. Like any medication, adenosine may cause certain side effects. Most of these side effects are temporary and resolve quickly after the medication is administered. One of the most commonly reported side effects of adenosine is a temporary chest discomfort or pressure. This sensation typically lasts for a few seconds and subsides on its own. It is not usually a cause for concern, but it's important to inform the healthcare professional if it persists or becomes severe. Other potential side effects of adenosine include dizziness, flushing, and shortness of breath. These side effects are also typically temporary and resolve on their own. However, if any side effects persist or worsen, it's important to seek medical attention to rule out any complications. In rare cases, adenosine may cause more serious side effects, such as severe allergic reactions or heart rhythm disturbances. These side effects are rare but require immediate medical attention. It's important to be aware of the potential risks and discuss any concerns with a healthcare professional before using adenosine. User feedback on adenosine. To gain a better understanding of adenosine's effectiveness and user experience, it's valuable to explore user feedback and experiences. Many individuals who have used adenosine report positive outcomes, with the medication successfully restoring a normal heart rhythm and alleviating symptoms associated with irregular heart rhythms. Some users have described the administration of adenosine as a brief but intense experience. The temporary chest discomfort or pressure sensation, often referred to as a adenosine flush, is commonly reported. However, users emphasize that this sensation quickly subsides, and the benefits of restoring a normal heart rhythm outweigh the temporary discomfort. Users also mention that the rapid onset of adenosine's effects is a significant advantage. Many individuals experience relief from their irregular heart rhythms within seconds of the medication's administration. This quick response time allows for immediate evaluation of the heart's response and adjustment of the treatment plan if necessary. Overall, user feedback suggests that adenosine is an effective medication for restoring a normal heart rhythm and managing irregular heart rhythms. However, it's important to remember that individual experiences may vary, and it's crucial to consult with a healthcare professional for personalized guidance and recommendations. Alternative treatments to adenosine. While adenosine is a commonly used medication in the field of cardiology, there may be alternative treatments available depending on the specific condition and individual patient factors. Some of the alternative treatments for irregular heart rhythms include medications such as beta blockers, calcium channel blockers, and antiarrhythmic drugs. These medications work by different mechanisms to regulate the heart's electrical activity and restore a normal rhythm. In certain cases, individuals may require more invasive treatments, such as catheter ablation or cardioversion. Catheter ablation involves using radiofrequency energy to eliminate abnormal electrical pathways in the heart, while cardioversion uses electrical shocks to reset the heart's rhythm. These procedures are typically performed by specialists and may be considered when other treatment options have been ineffective or when the irregular heart rhythms are recurrent and significantly impacting the individual's quality of life. The choice of treatment will depend on various factors, including the underlying cause of the irregular heart rhythms, the severity of symptoms, and the individual's overall health. A healthcare professional can assess these factors and recommend the most appropriate treatment approach for each individual. Precautions and considerations when using adenosine. When using adenosine, it's important to consider certain precautions and factors to ensure its safe and effective use. Adenosine should not be used in individuals with known hypersensitivity or allergy to adenosine or any of its components. It's important to disclose any known allergies or sensitivities to the healthcare professional before using this medication. It's also essential to inform the healthcare professional about any other medications or supplements being taken, as adenosine may interact with certain substances. For example, medications such as dipyridamole and carbamazepine may interact with adenosine, potentially increasing the risk of side effects or altering the medication's effectiveness. The healthcare professional will consider these factors when determining the appropriate dosage and administration method. Individuals with certain medical conditions, such as severe asthma or obstructive lung disease, may require special considerations when using adenosine. The healthcare professional will assess the individual's medical history and overall health to determine if adenosine is suitable or if alternative treatment options should be explored. Adenosine in medical research and studies. Adenosine has been the subject of various medical research studies and clinical trials, aiming to further explore its effectiveness and potential applications. These studies have investigated the use of adenosine in different patient populations and have provided valuable insights into its mechanisms of action and potential benefits. One area of research involving adenosine is its use in individuals with atrial fibrillation who are undergoing cardioversion. Studies have examined the effectiveness of adenosine in improving the success rate of cardioversion and reducing the need for repeated attempts. Results from these studies have shown promising outcomes, suggesting that adenosine may play a role in optimizing the management of atrial fibrillation. Adenosine has also been studied in combination with other medications or therapies to enhance its effects. For example, research has explored the use of adenosine in combination with beta blockers or antiarrhythmic drugs to improve treatment outcomes in individuals with paroxysmal supraventricular tachycardia. These studies have demonstrated the potential synergistic effects of combining different treatment approaches for better management of irregular heart rhythms. While ongoing research continues to expand our understanding of adenosine and its applications, it's important to note that the findings from these studies may not always directly translate to clinical practice. Healthcare professionals will consider the current evidence, individual patient factors, and their clinical expertise when making treatment recommendations. Frequently asked questions about adenosine. Can adenosine be self-administered at home? Adenosine should only be administered under the supervision of a healthcare professional, typically in a clinical setting. Self-administration at home is not recommended due to the potential risks and the need for proper monitoring during administration. How quickly does adenosine work? Adenosine works rapidly, with its effects typically felt within seconds of administration. The quick onset of action allows for immediate evaluation of the heart's response and adjustment of the treatment plan if necessary. Can adenosine be used during pregnancy? The use of adenosine during pregnancy should be carefully considered and discussed with a healthcare professional. The potential risks and benefits for both the mother and the developing fetus will be evaluated to determine the most appropriate course of action. What should I do if I experience severe side effects after receiving adenosine? If you experience severe side effects after receiving adenosine, such as severe allergic reactions or heart rhythm disturbances, it's crucial to seek immediate medical attention. These side effects are rare but require immediate evaluation and management. Can adenosine interact with other medications? Yes, adenosine may interact with certain medications, such as dipyridamole and carbamazepine. It's important to inform the healthcare professional about any other medications or supplements being taken to ensure there are no potential interactions. Conclusion: adenosine is a medication commonly used in the field of cardiology to treat irregular heart rhythms, such as atrial fibrillation and paroxysmal supraventricular tachycardia. By slowing down the electrical conduction in the heart, adenosine helps restore a normal heart rhythm. However, its use should be determined by a healthcare professional who can assess the individual's specific condition and recommend the appropriate dosage and administration method. While adenosine is generally well tolerated, it may cause temporary side effects such as chest discomfort, dizziness, flushing, and shortness of breath. These side effects typically resolve quickly and are outweighed by the potential benefits of restoring a normal heart rhythm. User feedback and experiences with adenosine suggest positive outcomes, with many individuals reporting relief from irregular heart rhythms and improved overall well-being. However, it's important to consult with a healthcare professional for personalized guidance and recommendations. Adenosine is just one of the treatment options available for irregular heart rhythms, and alternative treatments may be considered depending on the specific condition and individual patient factors. A healthcare professional can assess the individual's situation and recommend the most appropriate treatment approach. By understanding the primary uses, dosage guidance, potential side effects, and user feedback, individuals can make informed decisions regarding the use of adenosine and its role in managing irregular heart rhythms. As research continues to explore the potential applications of adenosine, healthcare professionals will incorporate the latest evidence into their clinical practice to optimize patient care.